variant. But first, on vaccinations, 10.9% of Victorians 12 and above have now had their third dose. This is a significant milestone to pass 10%, but there is therefore still a very large number of people who need to come forward for their third dose, and we'll deal with that in just a moment. 93% of Victorians have had their second dose, and that is really the fundamental pillar on which our COVID response is built. It gives us so many more options to deal with the COVID outbreak compared to so many other places around the globe. Among people with COVID-19, 491 Victorians are currently in hospital. That's a small but continued increase day in, day out over the last little while. There are 104 people in intensive care, of which 24 are on a ventilator. Very sadly, a further 3 Victorians have passed away with COVID over the previous 24-hour reporting period, and our condolences are with those families and the loved ones of those Victorians. Yesterday, 44,168 Victorians got a PCR test. Many, many more thousands clearly were tested with rapid antigen tests. And as a result of those, we now have 38,118 active cases of COVID-19 in the Victorian community, and there was a further 8,577 people diagnosed with the virus yesterday. What we will have protected through these more than 8,000 plus people who have been vaccinated is that level of protection for that third booster dose that is so critical to give us options for responding to Omicron and whatever else this global pandemic pitches up at us. As we head into 2022, it is more important than ever, if you are eligible for that third dose, to come forward and get it. And when kids 5 to 11 in a week's time become eligible for their first dose, for those kids to come forward. This is what will give our defences against COVID and against the global pandemic the strong face that we need, especially as we deal with the very infectious Omicron variant of concern. When it comes to those doses, I'm pleased to say that as from tomorrow, Victorians who have had their second dose of COVID-19, that is 4 months or more ago, can get their third dose at state-run vaccination clinics right across Victoria. So that implements the decision from National Cabinet before Christmas to bring forward that third dose from 5 months to 4 months as of tomorrow. In addition, kids can book through the state-run system, or their families can book through the state-run system in anticipation of those kids from 5 to 11 becoming eligible for their vaccinations as from the 10th of January, in 1 week's time. As I've indicated, more than 10% of Victorians aged 12 and above have already had their third dose, and that means that there are, as of tomorrow, 1 million more Victorians become eligible for that third dose, in addition to those people who are already eligible. So what does that mean? That means if you are an adult, or indeed 12 years old and above, if you're in any of those categories and that you had your second vaccination in September or earlier, you are now eligible for a third dose as of tomorrow. And as we've seen, being fully dosed for third dose vaccinations is the best protection that you can have against the Omicron variant, to keep yourself safe, to keep your family safe, to keep you active in the community, and to do your bit to keep Victoria open. And as we've indicated, children between 5 and 11 are also recommended to get their first dose as of the 10th. And that program is, of course, now will be available online for families and carers to book their kids in. All of these programs, of course, are more than being led by our primary care partners in both general practice and pharmacies. They continue to do the majority of vaccinations for both third dose boosters and for kids 5 to 11. And we really want to see families come forward, and those million plus Victorians who are now eligible to come forward in strong numbers. That is what's going to get us to be able to respond to the Omicron variant and bring that rapidly rising curve down as quickly as possible. As I've indicated, parents and guardians for kids 5 to 11 can book through that online system as of 8 a.m. tomorrow morning, the 4th of January, either online or through the coronavirus phone hotline. Online bookings will require a unique mail address, which can be the child's address. Many kids under 11, of course, have those, or one belonging to the parent or the guardian. Bookings can also be made through your local pharmacy or your local general practitioner. To support this effort at both the 5 to 11 and the more than million adults of 12 and above who are coming online as of tomorrow, we are delivering a massive scale-up capacity through our state-run vaccination clinics. We will be ensuring that up to 300,000 Victorians can get vaccinated every week through our ramped-up state-run clinics, and we look forward to meeting that number to make sure that we push down that Omicron curve. Of course, our partners in community health, in general practice and in pharmacies will be part and parcel in addition to those 300,000. The flagship centre at the Royal Exhibition Buildings will now stay open until late March, and 6 other state-run vaccination centres previously in a pre-Omicron environment scheduled to be scaled down will now stay open to maximise our opportunities to get as many people vaccinated as quickly as possible. From this Wednesday, the 5th of January, 28 state-run booster pop-up vaccination clinics will also open right across Victoria. We'll provide you details of those, but in the regions, in the suburbs, in the holiday facilities, we will be making sure that we provide all the opportunities that people who have become eligible to come forward and get that third booster dose. And all the existing current fixed sites will now expand to operate 12 hours a day, 7 days a week. We will also provide, as we indicated before Christmas, a series of vaccination enhancement grants and vaccine supply support for our GPs and pharmacists, particularly in those areas that we know where there is an underrepresentation of primary care providers in the community. We want to make sure that those vulnerable parts of our state get the support they need to get those vaccines into people's arms as quickly as possible. In that regard, we've had over 150 GPs and pharmacies already share in over $2 million of those enhancement grants that we announced immediately prior to Christmas, and I'm sure we'll have more to come. We know that vaccines work. We know from 2021 that they give us options to get open and stay open. And it is really in the hands or in the arms of more than 1 million Victorians and more than 578,000 kids from 5 to 11 to now come forward, get those vaccines and help us drive down this Omicron variant. That will help us care for people right across the Victorian community as we see increasing numbers of people getting infected with this Omicron variant. That's how we keep people well. That's how we drive these rapidly growing curve down, and that's how we stay open and stay safe. That's what keeps us all safe, and it's a significant contribution that we can all make. So please, I'll just finish before I hand over to Jerome. You can book your first or your second dose for kids 5 to 11, or you can book your own third dose from 12 and above at coronavirus.vic.gov.au/vaccine, or you can phone the coronavirus hotline on 1800 675 398, or of course through your local pharmacy or GP. Before I hand over to Jerome, I just apologise for not having an Auslan interpreter here today, a public holiday, and unfortunately even our Auslan interpreters need a day off. So I'll hand over to Jerome, and then we're happy to take questions.
Thank you, Minister, and good afternoon. With 8,500 cases reported in the last 24 hours, that takes us to 23,000 cases in Victoria in the first 3 days of 2022. It also means in the first 3 days of this new year, we've had more cases already than all of 2020. It shows you how fast Omicron is moving across the eastern seaboard. It shows you how rapidly we all need to move and adapt our behaviours to meet this oncoming challenge, and this wave is now certainly right upon us. We are, of course, seeing at this point a lower rate of hospitalisation from Omicron cases, but it's still very early days. And we are seeing our hospitalisation numbers start to increase, with 491 Victorians now in hospital with COVID, and we expect to see those numbers continue to increase quite rapidly in the days ahead. And certainly if we look at the experience in New South Wales, who appear to be about a week or so ahead of us in this pandemic, they're now starting to report quite significant numbers. So it's really important that we all adapt our behaviours and we all take the actions now to minimise the impact on all of us and our families. The most important thing we can do, as the Minister has said, is get our booster doses done. Anybody aged over 18 who has had their second dose before September of last year is now eligible to get their booster dose. From tomorrow, the 36 state clinics will be opening up. As the Minister said, we're running extended hours with pop-ups across many parts of the state. I'd really urge everybody to get your vaccination booking done. Go online now and get those booking appointments made. Some of those clinics will also be offering a walk-up service. Again, please check details on our website. We really want to see as many of those 2 million Victorians that are already eligible coming forward and getting their booster doses done in the days ahead, so we can stay ahead of this, and certainly by the end of February get the vast majority of the population in Victoria done with their booster dose program. That is the most effective way for us to minimise the damaging impact of this Omicron wave that's now upon us. Can I, at this point, also thank our healthcare workers who've been working tirelessly over the Christmas and New Year period, not only in our testing regime, but also in getting ready for this big vaccination surge. And of course our colleagues in primary care, the many pharmacists, GPs and all their support staff who've been doing all the preparation work to get appointments into the system to make sure the clinics are ready to open up again tomorrow, to make sure as many of us as possible can get our booster doses done. For all the rest of us, it's now time to focus on that, to work out when we had our second dose and to make that appointment to get our booster dose done in the weeks ahead. In terms of the testing program, of course, we're seeing record numbers of positive cases, but also record numbers of positivity rates. So the rate of positive cases of all the ones we're testing has gone to numbers we've never seen before. We're now seeing 1 in 5 cases who are being tested in our PCR system is now positive. That's a 10-fold increase in the space of the last couple of weeks, where normally we'd be running at around a 2% positivity rate. We have done now, over the Christmas weeks, over the last couple of weeks, almost 1 million tests have been processed by our labs over an exceptionally busy time of year, and of course when all of our lab staff have also got other things on their minds. So first I'd like to thank our pathology labs for the huge efforts, the superhuman efforts undertaken over the last couple of weeks to stay on top of this growing number of cases that we've had, the growing number of tests we've had to process and the growing positivity cases. We've also had to change all of our procedures in our labs. When we were running at lower rates of positivity, we would pool all of our samples together, we'd essentially batch them up and run them through the labs, and only where we then find a positive rate in a group of tests, retest those that subset to work out which cases were positive. Because of the very high rate of positivity we're now seeing in all of our tests, every single test is now processed individually through all of our labs. That means that it takes us longer to process individual test results. That means that we're starting to see longer turnaround times on all of our testing results. We would normally have a hallmark of 9 out of 10 tests coming back by the next day. We're now seeing a third of our test results coming back by the next day. We're seeing half of our test results coming back within 2 days. So I'd like to apologise to everybody who's waiting for your PCR test result. It is because we're seeing far more positive cases in our samples that we're having to do more work within our labs at a point in time, of course, where our labs are also seeing a very high number of cases coming through, very high number of tests coming through, and we're of course expecting to see more tests over the days ahead. So I'd ask everybody who is waiting for a positive test result, please be patient and bear with us and bear with our lab staff while they work feverishly through all of those test results. And of course, if you're thinking about getting a test today, I would only ask people who are currently symptomatic or people who've already returned a positive RAT result to come forward for a PCR test. You'll see now the sheer pressure on our system, the sheer number of cases we have to process. I'd really only want to ensure that people who are currently symptomatic or people who've already returned a positive rapid antigen test result to come forward for PCR tests over the coming days. Well, that is why, of course, we ordered before Christmas 34 million rapid antigen tests into the state. We're expecting the first of those deliveries to arrive in the coming days. And as soon as those deliveries arrive and are solid, we'll start to bring forward rapid antigen testing into our mainstream state system. And we'll make those announcements when those orders arrive into our hands. In terms of what that means for all of us, if you've got a positive PCR result, you must isolate for 7 days. And the people you live with must isolate for 7 days. That's really important. If you've had a rapid antigen test result and your rapid antigen test result is positive, we'd like you to isolate until you can get a positive PCR result. If the PCR queues are too long, if you can't get a PCR result, then please continue your isolation protocol on the back of your rapid antigen test result. You can, of course, take repeated rapid antigen tests to confirm that result. If you're symptomatic, we'd like you to isolate until you can get a rapid antigen test result or a PCR result. With such a high number of cases now in our community, we have to assume, if we're symptomatic, that we're probably contracting COVID. We need to be very mindful of exposures to our loved ones and other people in the community. So please, if you're symptomatic, we'd like you to get a PCR result or a rapid antigen test result as soon as possible. But in the meantime, please isolate and act as if you are positive. That is the way in which we'll all get through this and some very challenging days and weeks ahead. Finally, of course, we're seeing with a rapid number of cases, 38,000 confirmed positive cases now in the state. Of course, more and more people are being impacted by being close contacts. We now have 1,700 healthcare workers who are currently impacted by being a close contact or a social or workplace contact of somebody who has got COVID. We've been working very closely with our health services and the unions and other stakeholders to establish safe and effective arrangements whereby healthcare workers can return to work safely using a rapid antigen testing protocol, even if they are social and workplace contacts of a positive case. That requires them to undertake a structured regime of daily rapid antigen testing before going to work, to not have symptoms, and to go through a control process that will be rolled out by our healthcare services. I'd like to thank, of course, all those healthcare staff who have worked so incredibly hard over the last few years, who've worked so hard over the last couple of weeks, and particularly those who, despite the fact they may be close contacts, are willing to go through that rapid antigen testing results on a daily basis to ensure they can continue to provide care to patients in our health services. We're going to need our healthcare workers more than ever before, and we'll continue to work with them to ensure they can turn up to work safely and be supported for the amazing work that they do. With that, I'll hand over to the Minister and we'll take any questions.
Thank you. Happy to take questions.
When will the first batch of the rapid antigen tests arrive?
In coming days, we await the vagaries of the international air freight industry, but our expectation is in coming days of this week, the first initial arrival of those rapid antigen tests ordered before Christmas will begin to arrive.
And have you worked out how they're going to be distributed?
The two are linked. We've got an expectation as to how many are coming. Until we see them on the tarmac, we'll be a little bit sceptical. But yes, we are working on particularly how to provide those vulnerable Victorians who will need access, given the challenges that we've just gone through in access to PCR tests. So whether it's those Victorians who need that because of the expense or because they're vulnerable status in the community, as well as starting the rollout more broadly. So those Victorians who require the provision by the government of free rapid antigen testing starts to happen.
44 million is not a lot for a population of roughly 7 million. But, for example, healthcare workers are taking them every day. So who will actually be able to get access?
So in terms of healthcare workers, for instance, we've already got another series of supplies through the healthcare system for that. But in terms of the issue of who becomes available, clearly, until such time as we get really significant, consistent supplies across both government-provided services and other services, they will be in short supply. I noted today that the Commonwealth indicated that they were now also in the market of providing rapid antigen tests to residential aged care and other facilities, and had placed some substantial international orders. As all of these orders start to come in, that transition as to who becomes available for what in the fairest possible way will have more to say. Understand that various federal ministers have been suggesting that this might be the subject of discussion at National Cabinet on Wednesday.
The Prime Minister also said that when they're not in a position to give them away for free. How did you react to that?
Oh well, what's been a national issue about how governments at all levels have a responsibility to provide access freely to testing, which has been the case for nearly 2 years now. I'm not sure how we can all just walk away from that commitment. The Prime Minister has his views. The states clearly have a view that that is part of our responsibility. What we've seen consistently from the Prime Minister is his ability to transfer responsibility to the states. That's just the way this Prime Minister operates. The states clearly have a view that freely available rapid antigen testing as part of an ongoing response to Omicron forms part of what should be a national response. In lieu of that national response, the states have to fill the void.
The Prime Minister has said that they'll fund 50% of all rapid tests. Is it your understanding that that funding will only flow when the test is used for a kind of person who's being asked to get a test, rather than someone who just wants a test who is not in close contact under perhaps a health partnership?
I think vaguely that's what we've been led to believe. We'll work with the Commonwealth. We hope that they'll provide 50% of all the rapid antigen tests that the states provide. In terms of the finer detail as to what's provided under the interjurisdictional agreements that govern COVID costs, we'll just have to wait and see what the Federal Treasurer signs for the cheques.
Some of the pharmacists are saying, and other retailers are saying, that in a few weeks the country will kind of be awash with rats, and this is a temporary problem. Are your people in the department telling you that, in 3-4 weeks' time, by the end of this month, we won't be having this conversation? There'll be so many in retailers, they'll be a bit cheaper as well, and they'll be easily accessible.
We certainly hope that that's the case. We've seen right across the globe that freely available, readily distributed rapid antigen tests form a key part of ongoing responses to the global pandemic. That was always going to be the case here in Victoria and across Australia. We'd been making provisions for that. When the national rules changed last Wednesday, we all had to respond very quickly. I think the Prime Minister did describe this as a transitional period. I hope that's the case, and I hope it's a transition to readily available, freely available rapid antigen tests to all those Victorians and Australians who require it.
You were talking before about, you were sceptical about how many would arrive and when they would arrive. Can you tell us, what have you been told as to how many will arrive?
Yes.
And when they will arrive? What's been the conversation?
As we indicated before Christmas, we confirmed orders for 34 million rapid antigen tests from a range of both Australian and overwhelmingly international suppliers, and those dates are now starting to click in as of later this week.
And are we expecting 34 million by the end of January? Or
Yes.
And the amount that you're expecting to arrive this month?
In the several hundreds of thousands, but we expect that number to grow week on week to the multiple millions in the very near future.
in the short term, for people who are sort of waiting over the next week to get a test, what's your advice to them? What should they be doing?
Well, as Jerome indicated, firstly, we apologise for the delays. On the one hand, with the unavailability of rapid antigen testing in the wider community, and on the other, the difficulties that we're now seeing with very high positivity rates through the PCR system. This is not a good position, and I also apologise to those Victorians who are waiting. That is why it's so important that the only people who should be coming forward for PCR tests are those with symptoms or those who have ticked over a rapid antigen test. And that will help manage that process and the difficulties that with such high positivity rates that Jerome touched on. What we want to do is make this transition in the quickest possible time and get those rapid antigen tests as the basis of our pillar of response out there in the Victorian community as soon as we possibly can, and we'll have more to say about that in coming days. Well, we too expect, sadly, the numbers to continue to increase really exponentially, as we've been seeing. You'll recall that the December meeting of National Cabinet received advice from the Doherty Institute, which essentially pointed to precisely what's happening. If anything, the Doherty Institute's modelling might indeed look to be conservative in terms of the infectivity rates that we're starting to see with Omicron. We've already introduced some public health and social measures before Christmas, and we'll continue to monitor those arrangements. But the biggest thing we can do is to get that third booster dose into the arms of the millions of Victorians who are now eligible for it. All the evidence shows that that third booster dose not just increases your capacity to avoid catching the Omicron variant, but even more importantly, it prevents you from getting severe illness. And if you avoid severe illness, then you're not in hospital and you're not in ICU. So the most important thing we can do is, yes, continue to monitor the public health and social measures of a response, but the most important thing we can do is to get that third booster dose, and for those kids 5 to 11 to come forward as of the 10th of January and start to get those vaccines.
Big events around the Australian Open, potential spread of events. Is there going to be any sort of crowds or festivities that's
Well, we managed in a initially early Omicron, as it now turns out, significant event at the MCG for the Ashes test in a pretty significant way. The COVID-safe plans that we've put in place with Tennis Australia, we have strong confidence in, but like all these things, we'll continue to monitor the arrangements and work through any issues with the Australian Open or any other provider. But having said that, there are no plans to do anything other than see the Australian Open go ahead with as many people as we can get into the place as safely as we possibly can, in line with the COVID safe plan that we've signed up to with Tennis Australia.
How much of a consideration when you rejected the Chief Health Officer's advice for density caps and other restrictions pre-Christmas, how much weight was given to the fact that it was Christmas time in normal, and now that we're past that Christmas period and you wouldn't be cancelling family events and other scheduled events, would bringing in those kinds of restrictions be more palatable now?
So just to address the premise of your question first, before I come back to the substance. So you recall when you read all of the Chief Health Officer's advice, there were a series of proposals, but then there was a series of commentary about how important it is for public health advice to have support and public health measures to have support across the wider community, indeed pointing to a number of challenges that the implementation of that advice would cause. And that is very much the reason in which my decisions based on what was reasonably necessary, appropriate and proportionate before Christmas was framed around those very issues. Those very issues of making sure that families and communities could get together over Christmas and New Year, that events could go ahead, and that in doing so, we took the measures of, the very important measures of the masks in indoor settings, very strong recommendations around other measures in hospitality and other measures to keep Victorians safe when it comes to, if you can work from home, you should, those kind of arrangements. So I believe that I acted very much in accordance with the Chief Health Officer's advice when you take the full context of that advice. In terms of ongoing measures, we continue to review those measures in light of the epidemiological circumstances. We don't have anything further to add today, but of course we don't rule out the prospects of adding or indeed subtracting to the public health orders.
Updated advice from the Chief Health Officer this month. Will that happen in the next week or so?
Well, as you recall, the pandemic legislation that passed the Parliament in December allowed for, under those new laws, an initial 1 month declaration of pandemic orders, and then that required the pandemic declaration to be revisited in 1 month. That is next week, and then there will necessarily have to be further orders next week because the existing initial 1 month orders expire as per that legislation.
There are some,
given so much of the restrictions that are based around making our hospital system open, how many of those are vaccinated?
Well, intensive, I can't say right now, but as of Friday, the overwhelming majority of people in intensive care were unvaccinated or partially vaccinated, way up into the 90%. I was, I have to admit, taken aback when I, in PPE, had a tour of the Alfred's intensive care unit, which has now been expanded to 3 levels, but an entire level of the Alfred's ICU on Friday was full of people, every one of them, who was not fully vaccinated. Some of them, the largest number of them, unvaccinated. And that, if you want a poster as to why you need to come forward and get this 3rd booster dose, is so you do not end up in ICU. Having said all that, I am aware that we've seen ICU numbers come down in Victoria over the past week, and I just looked at a few bits and pieces before we stood up today. In the past week, we've seen intensive care unit in Victoria numbers decline by 14 people. Oh, pardon me, the ventilators by 14 people. ICU numbers have come down by 24 people over the past week. Yet, at the same time, we've seen hospitalisation numbers increase by 124 people. And we've seen in the wider community now over 40,000 Victorians being actively, either themselves or with the COVID positive pathways and hospital in the home program, having their COVID status managed in the community. So we are seeing numbers of overall cases and numbers of hospitalisations increase, whilst we're seeing ICU and ventilators decrease at the moment. We compare that to New South Wales, who I'm afraid are really the path leaders in the direction of the pandemic around the nation. They've seen 112,000 people increase in COVID in the community over the past week. They've seen an increase in hospitalisation of 683 people in the past week. They've seen their ICU numbers go up by 40 people in the past week, and they've seen their ventilators numbers go up by 8. And if you work on the basis that we're a week or 2 behind where New South Wales are, we can't rule out that we'll continue to see an increase in COVID being managed at home in the community, an increase in hospitalisation, an increase in ICU, and an increase in ventilators. These are not good prospects to be looking at over the course of the coming month in January. We can deal with that by getting that 3rd jab booster, and by getting our kids 5 to 11 vaccinated. That will help us drive down those numbers.
Just on those numbers, I think that when you did the burnout Delta modelling a few months ago, the number for hospitalisations at which the system really started to reach its tipping point, I think was 1,500 at any one time. If we're heading in that direction, then New South Wales' numbers are still not factoring in the 20,000 cases of hospitalisations from here. If we're heading in that direction, are you concerned that we will reach a tipping point at our hospitals? Are you preparing increased capacity, field hospital capacity? What are we doing in that space?
So there's every indication that Omicron is not as virulent as Delta and its predecessors. That is a good thing. But that is more than outweighed by the prospects of it being so contagious that we are already seeing in the space of 3 days more people being infected than over the course of the entire first year of the pandemic. So we are, of course, preparing for further hospitalisations and further measures to manage what we can see to be increasing demand. And that's why the kind of important measures of whether it's hospitalisation, working with our primary care partners, working to make sure that we've got the workforce, our already fatigued and overworked hospital and primary care workforce, to make sure that the furloughing arrangements are in place to sustain that expected peak. This will be a substantial challenge for our healthcare system, our hospitals, and I want to thank all of those people involved in the preparation of those moves to make sure that these challenges of the coming month can be overcome.
Both Brad Hazzard and now the Prime Minister have said that a lot of the cases that are being reported as hospitalised in New South Wales are there for other reasons other than
True.
COVID. So can you explain how we report our stats here?
We're finding exactly the same thing. So of course, we see many people through the streaming process and the PCR and the rapid antigen test process coming forward. We know that they've got COVID before they come into hospital, but what we are seeing now with so much transmission in the community more broadly, we are seeing people who are now tested automatically before they brought into hospital, ticking positive in ways if they're showing up for their cancer treatment, if they're showing up for their broken bones or their car accidents. And as a result, we have to then treat those people the same way, the same COVID positive and safe way that we treat everyone else who's got COVID. So we are seeing precisely those challenges, and that is putting further strain on our hospital system.
I understand that obviously that puts extra strain on healthcare workers and just beds filling up, but they're not really there for COVID. So when it comes
Well, they are once they've got COVID. They have to be treated as if they are highly infectious.
I understand that. From a staffing perspective, that makes sense. But in terms of the severity of the disease perspective,
Yes.
they're not in hospital for their COVID symptoms. So I'm just saying, as we move forward, are you going to be assessing the way you report on those hospitalisation numbers if it could be intrinsically linked to things like further restrictions?
No, I don't believe so. We'll continue to report COVID cases in hospital every time we see them, because yep, for both. We have a whole series of matrix of reporting who's in hospital, and you can be in hospital for lots of reasons with comorbidities now that are reported, and we'll continue to do that. If you're in because you've had a car accident and you've tested positive, you will be marked in the COVID positive arrangements, but you'll also be marked as a trauma patient in the trauma centre. And your trouble is you'll need to be managed in the trauma centre in a really different way to if you are not a COVID patient.
Western Health has put out a tweet just recently pleading with people not to turn up for their emergency departments at Williamstown, Footscray and one other that I've forgotten at the moment. In fact, this is sort of still very early on.
Yes.
Are you worried about that function?
Yes, I continue to be very concerned that all of our emergency departments are facing unprecedented demand that grows every day in the face of this global pandemic. We are seeing business as usual, for want of a better phrase, demand continue to grow as people get out more, as people come forward for all the normal things that a health service needs to deliver. But as more of those people are also coming forward, and as part of that testing positive for Omicron, that creates further strain on our healthcare system. We, through Western Health or any of the other health networks, seek to stream people who are COVID positive into particular areas, and smaller hospitals are less able to achieve that than the larger hospitals. So those kind of sensible measures that Western Health are putting in place, I think we'll find that all of our hospital networks are doing similar.
A lot of the testing sites had to close over the weekend.
Yes.
But do you regret those closing because it was a holiday, given how many people needed to test and the delay?
No, that was a safety measure for both our workforce and for those people who were required to sadly queue up if they were either symptomatic or if they had a rapid antigen test turned positive. I apologise for the delays that has put into the system, but in a system where we had 38, indeed higher degree temperatures, with tents that like an oven, increase that temperature a further 10 degrees Celsius, with our clinical and other staff in full PPE, it was not in their wellbeing interest, nor indeed those people queuing to be exposed to that heat. We could have seen worse outcomes.
I wasn't talking about the heat in particular. There were many that closed simply because it was a holiday.
In terms of testing centres and indeed vaccination centres, we want to make sure that our very hard working staff who have been at this 7 days a week for months, if not years, at least had a bit of a break over Christmas. All the centres that were scheduled to be opened were opened. Yes, some were suspended because of the heat, but the service was planned to be there, and I look forward to it having to now pivot to a different kind of PCR testing system, one built on rapid antigen tests once it becomes available.
New South Wales have said 75% of their ICU admissions at the moment for COVID Delta. Do you think that's the same makeup in Victoria?
I don't have that data with me right now, but as I've indicated, we've seen ICU and ventilation rates fall over the past week, and in fact the past couple of weeks. We know that these are delayed indicators from infections. Hospitalisation is a delayed indicator from an infection, and then ICU or ventilators a further delay. So we would expect to see the rapid increase in numbers, even with a less virulent strain, start to play out, as we've seen in New South Wales, in increased numbers in both ICU and ventilating in coming weeks.
Are we suspecting an increase, but maybe the capacity of ICU might not be as severe and get the numbers under control?
We're still learning so much about the Omicron variant. Yes, it is fairly clear that it is less virulent, but its infectivity and its ability to infect, as we've seen, so many more people so quickly, it doesn't need much to get into vulnerable populations, to people with pre-existing conditions, our elderly, our immunosuppressed community, and it's in those communities that even a less virulent strain can have severe health outcomes, and we want to really act quickly to get in front of that. And again, I'd use this as an opportunity. The way you can do that is to get your third booster dose if you're eligible, or if you've got kids in the age group of 5 to 11, get them vaccinated. Sure. So this is a government that is actually delivering on the city to airport rail link as part of both the suburban rail link and our massive infrastructure and public transport spend. In terms of specifics as to what any ticket would be, I'm not advised as to that matter. I've seen speculation in the media. That work is well underway. I'll let the relevant minister have more to say about that when the work's finished, other than to say this is a government that will deliver on the suburban rail link, and as part of that, the link to Melbourne Airport from the city. So, O is for emergencies. What we're seeing with COVID-19 through its Omicron variant is less severe cases as a general rule. But if you are facing a serious health incident, then that's what O is for. It's not for milder cases. It's not for, is a testing centre open? Where can I get support? That's what the coronavirus hotline is open for. Our ambulance services have seen demand absolutely at this, which is traditionally its busiest time of the year anyway, really be hammered over the last month. And we can all do our bit, whether it's for COVID or any other case, to restrict our calls to O for those aspects of a medical condition, a critical matter that O is designed for. There's nurse on call, there's your GP, there's your pharmacist for those other non-critical matters. And if in fact it's a coronavirus matter, please phone the coronavirus hotline. Well, we've been all promised, whether it's state-run clinics or GPs or pharmacies, supply from the Commonwealth this week. General Fruin has been pretty good since he took over in making sure supply is delivered, but that's a question you'll have to ask the Commonwealth. Jerome.
Oh. We've had people in our own office who get a test result back in 6 hours and others will still waiting 5 days.
Yep.
So for those who are waiting that long and are worried something may have happened to their test being lost or otherwise, what's the advice for people like that?
Yeah, look, first I'd apologise for anybody who's waiting longer than a day or two for your PCR result. I apologise. That is the huge work that our pathology labs are having to do to really deal with a higher rate of positive cases in all of our test samples. Please wait. Just what you should do if you're waiting for a test result, continue to isolate. Your test result will come. Don't go back to the testing centre to ask where the test result is. Just wait there. The test results will come through. We are just seeing some significant delays coming through. Again, if you're waiting more than 4 or 5 days, then please check in with the coronavirus hotline. But until then, I would ask you to isolate safely and to wait for that result to come through. Yeah.
Clarify what the isolation rules are for people who have tested positive and other than they get deemed as a close contact or otherwise, they still need to isolate, they still need to get a test.
Yep. Yes, as I went through probably about half an hour ago, so if you have tested positive on a PCR test or a rapid antigen test, you need to isolate for 7 days along with your household contacts. If you're on a rapid antigen test, we'd like you to get a PCR test. If you're finding that difficult, take another rapid antigen test to make sure that you're maintaining and tracking that positive state that you're in. That's a 7-day isolation period for yourself, but also for the people that you live with. That's the most important thing to take away from all this. What we will find as we go forward is we're all finding this, and I think in our social networks, is we're hearing of friends and associates who are becoming positive. So if you know you've been with a positive case, get yourself a rapid antigen test. If you can't get hold of a rapid antigen test at the moment, then monitor your symptoms very closely and be precautious, be careful about who you're mixing with. That's why we're seeing this large number of cases at the moment. There are things we can all do around meeting people outdoors, keeping our distance, wearing those masks indoors, all of which help us reduce that risk of transmission.
So that was something I was asking.
Okay.
I test positive.
Yeah.
My fiance doesn't test positive.
Yep.
A week later she tests positive, I'm recovered.
Yep.
Do I have to isolate?
No.
And what about in that regard then? How long does that last?
Right. So if you've been positive, we'd like you, if you are testing positive on a PCR system, you'll go through a 7-day isolation period. We are not seeing any evidence yet of people getting reinfected if they have previously been positive. So clearly, if you're living with another household member who turns positive later, if you have finished your 7 days of isolation, if you've been cleared, then you can go around your business as per normal.
Are you seeing many cases
Yes.
How
We don't have any. I don't have any real numbers on that. I'll check with the Chief Health Officer Paul around what prevalence we're seeing around that. But what we're absolutely seeing now is people who have been positive through the Delta wave of a few months ago, also now becoming positive again. What can you do about that? Again, this is why the booster doses are so important. That is a protection against getting seriously ill. That's the one takeaway you can take away from this, which is get your booster dose done as soon as you're eligible.
On the batch testing, you probably won't be able to start batch testing again until cases subside.
Correct.
Will there be a time in the next month or so where PCR times actually come back to that within 24 hours, or is that out?
No, absolutely. Look, and again, as we start to roll out rapid antigen testing, that becomes a bigger part of our platform. Again, go back to the National Cabinet decisions from last week. Increasingly, we will be using rapid antigen tests for our asymptomatic people coming forward for testing. That will reduce the pressure on the overall PCR testing system. We expect over the weeks ahead to be processing the number of PCRs that our labs can cope with to get back to those 80% turnaround times within a day.
Are those people who are reinfected with Delta, are they
Yeah.
proven to have less severe symptoms, or is it?
Again, too early to tell what we're seeing generally, but it's a huge generalisation. We're still very early on the Omicron wave. We're seeing, on the whole, less severe symptoms coming forward, fewer people appearing to end up in hospital. But again, we've only been dealing with this Omicron wave here in Victoria for the last 2 or 3 weeks. We need to see how the weeks ahead are going to look. And certainly with the numbers that we're seeing, even with that smaller rate of hospitalisation, it'll be a lot of people ending up in hospital.
I know the Minister went through this last Friday.
Yeah.
QR codes. AHPPC on Friday afternoon put out a statement saying that states should review the use of QR codes in lower risk settings like cafes and reserve them for hospitals, aged care facilities,
Yeah.
abattoirs. When do you think we might move to that system? What's the value of using it in a cafe at the moment?
Yeah, look, I think clearly with the QR codes remains an important thing, particularly for outbreak settings, and we can't predict which location next is going to become a significant outbreak of real concern. So whilst we're not doing the detailed contact tracing we were even a week or so ago, we would still want to reserve our rights to be able to deal with an outbreak in a certain setting. So at this point in time, we'd want people to continue to use the QR codes. It provides an important way for you to remember where you've been. It also provides you, now that you can download your own movements, a good record of where you've been and who you need to inform in the case that you do turn positive, and allows us to get onto those outbreak situations if we find them in the days and weeks ahead.
But under what circumstances would a cafe outbreak be one of concern? Under the new close contact rules,
Sure.
none of those people in the cafe where there's a positive case should get admitted.
Sure. No, look, and at this point in time, let's be very clear, at this point in time, we will continue to work in aged care settings, we continue to work in hospital settings and in some other locations, major events, where if we're seeing a cluster of cases, we will treat them as an outbreak, and we have our public health teams working very proactively in that space. We will continue to see other locations pop up from time to time, and the point at this point is that the reason for using the QR code the QR code system has many purposes. One, absolutely for us to use as an outbreak response. It's also there for individuals to recognise their vaccination status when they're going into those kind of settings, and we can see now, as never before, how important vaccination is as an entry check into those key settings. And finally, it's for individuals to manage their own movements as they're going through their own record of where they've been, to ensure they can inform people where they've been in case they do turn positive. So across all those uses, that's really important to us. Clearly, the situation continues to develop very quickly. If I'm really honest, Paul, right now my focus is on how do we ensure we get as many people as possible vaccinated and through the booster program over the weeks ahead. That is far more important. We'll continue to maintain those settings, and if we need to review them, we will when the time is right.
So essentially people have held out over the holiday period. You expect to do an uptick now that the New Year's period?
Yeah, absolutely. I think for all of us, look, we've all been through a pretty horrific 2021. We're all desperate to get to that wonderful Christmas and New Year period. I can completely understand that people have had other things on their mind over the last couple of weeks, but we've been doing the work in the background to make sure that we can get as many people through the vaccination program over the weeks ahead, and I mean the days and weeks ahead. The GPs, the pharmacies, our state clinics are ready and waiting. We need to see people coming through, because that's the only way we will avoid significant numbers of people ending up in hospital over the weeks ahead. Okay? Thank you all.